When your partner is still covered to stay warm, you start by establishing contact, at the same time center and relax yourself. You might also feel into your partner's breath movements. You may gently rock her so that she can fully arrive on the table and relax. You may massage the head superficially over the scalp, through the hair in circular moves with pointed fingers, and a bit deeper by gently moving the scalp against the skull. Distribute oil in circular, round moves. Use the entire surface of both hands, molding to the back for the basic stroke. Both hands together, slowly down on both sides of the spinous processes, down to the sacrum, elongating the spine, rotating hands out to the flanks, and pull up parallel to the ribs. Between the scapula and again lateral over the shoulder, back to the middle to lengthen the neck, maybe all the way into the hair. Always lengthen the spine, pushing the sacrum caudally, widening, rotate the palm of your hand over the shoulder and pull the neck cranially. You may vary this basic stroke by using fists slowly, increasing pressure by using your body weight. You may use your forearms. Always make contact with as big and white skin surface as possible, and repeat as many times as you like. Mold the hands to the contours of your partner's body. Lateral strokes with alternating hands. Establish a continuous flow and a calming rhythm. Keep always at least one hand on the body. Move the long trunk muscles laterally away from the spinous processes. One hand with thenar and thumb on the body, the other applies the pressure. Use your body weight. You can always return to a long integrating stroke. Thumb and thenar pushes the muscle, the other hand applies the pressure. Integrating stroke. Now do a rotating move with both hands around the shoulder blade, almost like you want to turn a wheel. Fingertips can go into the supraspinatus groove. You can lift the shoulder a little to get almost under the scapula. And apply oil down the arm for long strokes. Squeeze the palm of her hand into the table. Squeeze. Take an arm out to the side of the table, holding it near the elbow joint. Sit down at the side of the table next to your partner and rest her arm over your thigh. Use both hands to lift and loosen shoulder girdle, bouncing up and down. Apply pressure with thenar and hypothenar on upper trapezius, squeezing and lateral strokes. And do the kneading movements, alternating with the thumb of one hand gently squeezing your partner's muscle against the fingers of the other hand. Establish a calming rhythm and flow. Gently squeeze the muscles. Swing the arm back onto the table and return to long integrating strokes. Now the other side. Use massage the entire arm, always molding your hands to the body contours. Squeeze palm down with your fist. The fingertips might be pointed and go into the supraspinatus groove. You can lift the shoulder to get under the scapula. Rest the upper arm on the thigh, kneading, thumb toward finger of the other hand. Gently squeezing. All the way down to the hand. Swing the arm back. And finish this part with an integrative stroke on both sides, both shoulders and arms together. Always trying to create space, widening and lengthening, and return to the basic stroke. Here's the basic stroke. Push down at the sacrum to the sides, between the shoulder blades, lateral to the shoulders, down the arms or up the neck. Cover the upper body and uncover the first leg. Molding your hands to the contours of the leg, do a full-length stroke similar to the basic stroke on the back. On the inner medial side, only halfway up the thigh, on the lateral side all the way up to the trochanter, and down all the way to the sole of the foot, gently squeezing. Starting from the knee, one hand up, one hand down. You can use your forearms and lean into them. Forearms up the thigh. Lift the leg to 90-degree knee flexion and lead the knee and the hip through a full range of motion. Holding the forefoot to wiggle the calf muscles, loosen the ankle joints. And lift the entire leg and gently shake it out. You can sit down on the table and massage the sole of the foot with squeezing moves, loosening the joints within the foot. Hold the foot with one hand that rests on the table and massage with the other hand around the heel and through the arch. Use pressure from the hypothenar. And end with long integrating strokes. Cover the first leg and do the same on the other leg. Long strokes, the hands molded to the leg. On the side, laterally, you go up to the major trochanter. Gentle squeezes. Do a slight traction. From the knee, one hand up, one hand down. Leaning into the leg with your forearms. Forearms up the thigh. And kneading moves on the thigh and calf. Grab the flesh and alternating squeeze between the thumb of one and the fingers of the other hand. You can put your knee on the table and rest her lower leg on your thigh, kneading the calf muscles. Massaging around the Achilles tendon. Integrating stroke. Range of motion. And stretch the rectus femoris by bending the knee and holding down the tip of the sacrum to prevent the pelvis from tilting and increasing the lordosis. Shake the leg out. To the foot. Squeezing, loosening the joints. And again, long integrating strokes down all the way to the foot. Half time. Partner turns over and you start on the front side of one leg. Cover the other leg. Long integrating strokes again with both hands molding to the contours of her leg. Again, on the medial side, only halfway up the thigh, laterally all the way up to the toe canter. Around the ankles. When you come down the thigh, slightly lift the leg from underneath and do some traction. Lifting, kneading, slight traction. Grab the flesh, knead the muscles, go around the kneecap, the patella. Lift the heel off the table and wiggle the leg loose. Sit down and trace the metatarsals up to around the ankles. Take the foot like shaking hands. Massage with both hands. Use thenar and hypothenar for the sole of the foot. Your fist. Standing again, one thumb pushes down on the other thumb, very, very, very slowly, flowing upwards through the tibialis anterior. Slow down even more if it hurts. Lengthen the foot, pull on the toes, each toe individually. Go into the web between the toes. Take your time. The leg deserves it. Both legs are almost half of your body. gentle traction. And after you massage more specific areas, always return to long integrating strokes. Kneading the thigh with both hands. The hands as big as possible for lots of flesh. Lift the entire leg and wiggle. Push into internal hip rotation and allow bouncing back to external rotation. Finish with long strokes. Now we're getting to a head and neck. The head rests on the table and may be supported, for example, by a folded towel. Take the head in both hands, similar to how you would hold a bowling ball. Gentle traction to lengthen the spine. Do lengthening strokes at the back of the neck. You may go all the way into the hair. With your fingertips, massage the scalp in circular movements, both superficially and deeper by moving the scalp over the scalp. Always return to long neck strokes, lengthening the back side of the neck. Apply lotion to the face, might be better than oil. Use the thumbs and fingers to stretch the facial muscles laterally, sideways. Maintain as broad a touch as possible. Do the entire face, directing the strokes from the midline to the side towards the ears. Work it down from her front down to nose, around the mouth, chin and jaw. Circular massages for the cheeks and temples. Take some time to go into the many grooves and crevices of the ears. Always return to lengthening the back of the neck. Do a long integrating stroke from the sternum, moving laterally below the clavicles, over to the shoulders and back behind the trapezius to the length of the back of the neck. Enjoy stretching the pec minoris. Come to the basic move to lengthen the back of the neck. Now alternate hands to grab the back of the neck with your fingers crossing the midline. Gently squeeze the neck muscles between thumb and fingers. Alternating, one hand massages the back of the neck while the other supports the head. Always try to lengthen the cervical spine. Rotate the head to one side to rest on one of your hands that itself is resting on the table, and do circular massage with fingers at the suboccipital muscles. And gentle squeezing strokes to the entire neck, maybe with some focus on suboccipital muscles. Side. Your own hand that holds the head can rest on the table. Standing at the side of the table, hold the opposite shoulder of your partner down against the table and use your free hand to gently side bend the neck with minimal rotation, leading the entire neck and head towards you. That stretches the scaling muscles. And lengthen the neck strokes at the same time. Get gentle side bending with minimal neck rotation. Come back to the basic stroke for back of the neck. Finish with a global neck stretch, forward flexion. Supporting the head with your crossed forearms and your hands holding down the opposite shoulders. Apply oil to shoulder, girdle and arm. Long strokes molding your hands to your partner's arm. For strokes up the arm, you can use your other hand to press your partner's wrist down against the table. both hands for long strokes starting at the sternum, lateral underneath the clavicles, then down the arm. Loosen the shoulder girdle between both of your hands and go with your hypothenar over the pec minor, pushing the shoulder back. Knead the arm muscles with both hands. With one hand, hold your partner's hand down against the table. With the other, form a fist and go very, very slowly over the extensor muscles of the forearm. Use some traction to lengthen the arm while massaging the hand. Sit down on the table on the side. Flex your partner's arm to 90 degrees at the elbow and massage her palm, thenar, hypothenar, with both of your thumbs. Stretch the fingers into dorsal extension by going between the fingers. Get up from the table and hold the outstretched arm, massaging every finger individually. Lift the entire arm, holding it at the wrist, and shake it out. And this side with a long integrating stroke. And go to the other side. When going up the arm, hold the hand down against the table. Shoulder girdle in both hands. Loosen the shoulder girdle. Go with your hypothenar, the groove between the thorax and the shoulder girdle. Lengthen the arm. With the dorsum of your proximal finger phalanges, go very, very slowly up over the hand and finger extensors. Hold with the other hand, your partner's hand down. Sit down with your back to your partner. Flex her arm at the elbow and gently bend the wrist and MCP joints into extension. Massage the palm of her hand. Widen her hand at the metacarpals. And massage each finger individually. Kneading the arm muscles by alternating squeezing the muscles between the thumb of one hand against the combined fingers of the other hand. integrating stroke from sternum over both shoulders down both arms. Now cover your partner. And with light touch over the cover, do an integrating stroke from the abdomen up to both shoulders and down the arm, and very long from both feet up the legs, belly, shoulders, and down the arms. End the massage by standing at the side, one hand over the heart, the other over the belly. Center yourself and sense into the movements of your breath. And very, very slowly lift your hands off from her. How do you feel now?